talking to my kids about this, and they don't actually see digital as part of the equation anymore. Like that's like foundational. That's table stakes for them.
Hello and welcome to Digital Health in Canada, the Digital Health Canada podcast. My name is Katie Brisky.
And I'm Sheila Maloney. This year marks Digital Health Canada's 50th anniversary, and we've got 50 reasons for you to tune into the podcast. Reason number one, which of course is in keeping with our theme of the podcast, celebrate today and create tomorrow. So we invite you to sit back, relax, and do just that.
All the way through season 2, we'll be exploring how far we've come and reimagining where we can go next as an association and a sector. And to kick off the festivities, we are honored to welcome 2 Digital Health Canada presidents from the association's early and current days. A very warm welcome to Denis Protti, Professor Emeritus of Health Information Science at the University of Victoria, and Chris Carvalho, CEO of Carveira Group Consulting, Inc.
I was saying off the air that I'm so pleased that you folks are here because Denis, you were sort of the founding members of Digital Health Canada, called Coach back then, and you created the UVic program. And Chris, of course, you're a graduate of the UVic program, and you're the current president of Digital Health Canada. So it's a wonderful circle, and it's a great way to start off our anniversary season. So thank you and welcome to you both.
Yeah, thank you. Excited to be here.
Glad to be here.
One of the things that we always do in just starting the podcast is we always ask people to talk a little bit about their career journeys and how they started and where they ended up and what were their maybe stops along the way. So Denis, why don't we start with you?
I graduated at the University of Alberta in mathematics in 1965, and I was fortunate in my last year to take 2 computer science courses. Offered a number of jobs, all related to the 2 computer science courses. Wanted to take the job in Connecticut with a life insurance company because I wanted to be an actuary. They wouldn't let me come back to Alberta to get married and take a few days off, so I ended up in Shell Canada in Calgary, where my wife and I got married in July of 65. After 2 years in Shell Canada, I found myself in Winnipeg, 1967. And to my surprise, not knowing why I was going to Winnipeg, I ended up in the medical school and starting a first and only computer department in the medical school at that time in Canada. We built up quite a little department, 17 or 18 people when I left. 72, I found myself across the river in St. Boniface General Hospital. I think they hired me as head of data processing, but agreed quickly to a change of, I think, director of information systems. So I was there for 6 years. And in 79, through all sorts of interesting ways and mysterious ways, I ended up in Victoria at the Royal Jubilee Hospital as the head of information systems. The Jubilee Hospital in Victoria in those days was quite a few years behind where I had left St. Boniface General Hospital in terms of the use of technology. However, what really took me to Victoria was a part-time teaching job at the University of Victoria in the School of Public Administration. So I started at the hospital in July of 79, and I started at the university in the first evening in September, teaching a graduate course in management information systems. While I was there, a committee was formed to look for a new director of a new program called Health Information Science. I was on the committee, and after a couple of unsuccessful attempts, I was taken aside and said, "We think you should step off the committee and put your name in." I did. I was then chosen to become the director of the program. And I started the program in July of 81. I think we became a school in 1983, and I was there until 2010. When I retired from the university from the teaching portion of my life. I stayed scientifically active by research and writing and consulting until 2017. And then I shut her down because I was running into conflicts with my time. I wanted to spend more time on genealogy than working in health informatics. So that's where I've been, and that's the process I went through.
That's a very circuitous route, but what a journey. I want to talk to you about the early days. We'll talk about that in a minute. Chris, why don't we talk about journey?
That's a tough one to follow. You should have let me go first, but I'll do my best. And honestly, like, thanks to Dennis for starting the program, or I probably wouldn't be sitting here talking to you guys today as a graduate. So, yeah, my career journey went to UVic, and actually wanted to become a sports agent, so nothing to do with healthcare at all. Realized that I probably wasn't cut out for that world, and didn't do too well in my classes that would have got me there, and somehow just fell into the health informatics space. A friend of mine was actually just coming off a co-op and was just telling me about the different opportunities and the curriculum and just the job opportunities that were there. So ended up taking a couple electives and really loved what I was learning. And then started to apply myself, got into the program, and the rest kind of history from there. Through that, obviously, you do three co-op terms. So did one with the health authority, one with consulting company, and that really took me down that path. So at that time, Courtyard Group, who would always come into the health informatics program and recruit heavily. I was lucky that we had that exposure through a number of different courses, and then got in the consulting world that way, learned the business, and then actually moved out to Edmonton for my first job. So spent a number of years there. From Courtyard, ended up going to work for MedAccess, just wanting to get more EMR project management implementation experience. Did that for a few years. During that time, Courtyard got bought up by TELUS Health, so then I went back to TELUS Health to help build their consulting practice. Did that for a few years, and then they ended up acquiring a number of EMR vendors, and they wanted me to go back and work in that space. I had already tried that and wanted to get something new, so ended up actually launching my own consulting company back in 2014, and have been doing that ever since. So have worked in a variety of different initiatives, digital transformation, implementation, just about every system. So I've never been a product specialist, but more of a process specialist in terms of how do you actually take a product and put it in, understand the workflow and the change management and project management required to do so. And yeah, I've just been really fortunate to be able to apply that skill set and experience across a number of different jurisdictions, provincially, nationally, and even internationally in some cases. So a very lucky journey that I kind of was in the right place at the right time to even be able to get into the health informatics program, which took me down the path that I'm in now.
Similarly circuitous, but impressive journey. It's always interesting when those career paths have those sort of hard right turns, right? Those crossroads that take you somewhere you never expected. And I'd love to take the conversation back to the early days of the School for Health Information Science. Dennis, I wonder if you can tell us a little bit about the impetus behind starting the program, some of the conversations that were happening at that time.
Okay. The roots of the program go back to 1963, actually. There was a medical records program at Notre Dame University, which was a small Catholic university in Nelson, BC. And in 73, they lost their accreditation, and subsequently the university closed down. So they shut down completely in 1977. They submitted a proposal to UBC to move the program to the University of British Columbia. That was rejected and turned down. The head of the university's commission at that time was a physician from UBC. Dr. William Gibson had the foresight to say, well, I think there's some merit in this. So he convinced the president of UVic, Dr. Howard Petch, to take a look at this program. He said, but change the focus. Don't focus on records. Focus on information. So Dr. Petch agreed, and he formed a committee. In 78, well, just late 78 to 79, the committee did put a proposal together, a 3-page proposal, to the Senate saying, here's a new program which we're recommending called Health Information Science. So in 79, the committee was struck, and someone heard about me or whatnot, and he was asked me to sit on the committee, on the selection committee. I did, I agreed, and so I sat on as a community representative on the committee. We went through a couple of searches, unsuccessfully, and then 2 of the committee members took me to lunch and said, a number of us think you should get off this committee and put your name in to be the director of this new program, which was a high-risk decision on my part because I didn't have a PhD. Okay, my wife and I finally decided, okay, let's do it. And I was subsequently chosen to be the director. And favorably enough for me, the committee was happy with everything I said, what my visions were, what my experience was, and whatnot. They were just concerned, could this man teach? He has no academic experience whatsoever. Fortunately, the School of Public Administration then permitted my teaching evaluation from the 4 courses I had taught over the years, and they were good enough to say, okay, he can teach, and I was given the job. I left the hospital and started in July of '81. There weren't many people working in the field in those days, especially academics. And the academic who influenced me the most was Jochen Mohr from Germany. Managed to recruit him and his family from Heidelberg to move to Victoria. And he was a keystone eventually in our program. We took on our first students in '82, and we went from there. We started, with, you all know, with a Bachelor of Science in Health Information Science only. And we did our first graduation class in, I think, '86. And of course, the school now is quite large. I think there's 9 or 10 full-time faculty members and 3 or 4 graduate programs, including a PhD program, and thousands of graduates out in the field.
What an accomplishment. You must be a sort of a proud father in all this, and you sort of started it. You think about the number and the not only number, but the caliber of the graduates in that program. There's so many really strong leaders that have gone on to have great success and great careers. And so, Chris, it's funny that you talked about having almost accidentally a friend sort of you got into the program. Can you talk about courses or professors, or do you have a story about Professor Protti that you'd like to share?
Oh, yeah. I mean, I was actually laughing about this because looking at the questions, it just brought flashbacks. Dennis, your classes were probably the only one that I actually did all the readings for because I remember you had these flashcards. You would ask a question and you wouldn't even see if anyone put their hand up. You would just pull a flashcard, and we just knew that there was a chance that we were the ones that were going to have to be able to be put on the spot and come up with an answer. And a lot of times there was industry experts that were coming in. So it was more in our senior courses where we were lucky to have like the CIOs and DMs and just the access to the network that Dennis was able to bring in. So it was almost like you were getting job interview questions live in the class, and you wanted to make sure that you were fully prepared. So that always kind of stuck with me prepping for this. I was like, I got to make sure I review this all because if Dennis pulls up those flashcards, I got to be ready. But I think that just speaks to the preparation. Like the program really allowed for and still does its graduates to be prepared for work in the field. I mean, luckily there's lots of jobs in the industry, but you also come out of it with 3 co-op terms, a lots of very tangible experience in the business technology and on all healthcare content. So you're coming out of it ready to work and already at that caliber. So I think a lot of us that graduated from the program, just some of those skills that you need in the workforce, we were able to build those up in the early days and then continue to leverage that throughout our careers. Luckily, we also had exposure to a number of key industry, both public and private sector players that we were familiar with. So when we were able to go and talk to them after class, and then we applied for a job or we had a project, there was always that reputation and familiarity because we came out of the program. And I think in many cases, a lot of those that were teaching or the faculty, they'd probably get calls about what were these students like, and they probably help to advocate for some of us. So yeah, just a really neat culture that was built. Like I think my graduating class was maybe 10. So, you got to know the profs very well and spent a lot of time learning and understanding from their experience and asking for advice on like where to go after and who should we talk to and what type of job should I get into, and then even staying in touch when you were early in the career and even now. I think now the graduate classes are 50, 60, which is amazing to see the growth, but just a real family kind of feel. So anyone that's part of that HIMF alumni, it's you got that connection, which has been helpful for sure.
Yeah, I remember once hearing sort of a list of graduates, and it almost sounded like a who's who of Canadian digital health, right? A lot of really familiar and, like Sheila said, well-established, well-known names. And Chris, you were just there talking to the class at UVic. Like, was that kind of family vibe still the same? Was it kind of a homecoming for you?
Yeah, it was. I got invited to be the keynote speaker at the alumni lunch a couple weeks ago, which was actually talking about my career journey and how the HIMP program had an impact on that. And it was nice. Like there's obviously lots of familiar faces and lots of individuals I get to work with on a daily basis. Many have connections nationally, so you get to see them at these different conferences. But also anyone new, it's like if you say you're a graduate of the HIMP program or you're a HIMPer, you immediately have that connection and that family feel, which is still evident going back. So always love, walking around campus and connecting. And then Sheila and I just had the opportunity to go speak with a class last week. So I think that's also one of the nice things they do is they try to bring individuals back as much as they can, so that if you're a graduate or you're connected to the program, you want to be going back and seeing who the next leaders are and just getting a sense of what they're thinking about and learning about. So yeah, it's always fun to head back to campus.
Maybe we'll switch gears talking about beginnings in first. So, of course, Dennis, you were one of the founding members of Digital Health Canada, which back in 1975, 50 years ago, was called Coach. And I was talking to a group very early on in my role as CEO of Digital Health Canada, and I was just reminding people of the old name. And Coach stood for the Canadian Organization for the Advancements of Computers and Health. So even when you say that acronym, it sounds so dated. And actually, I have, through our anniversary celebrations, we've managed to dig up the very first letter from the founding Coach president, Stephen Husing. And if you'll indulge me, I just want to read. It really talks about the impetus for putting the group together. It says, if the process of learning is to be meaningful, it's essential to have a contribution not only from the data processors, but also from administrators and the medical and paramedical professionals. I thought that was interesting. And then the very last sentence is, the history of computers in the healthcare delivery system is a short one in our country. The increased utilization of computers is not only self-evident, but inevitable. We hope that Coach can serve as a focal point for the process of sharing our thoughts and learning from one another. That really resonates, even if the terminology is a little bit different, but it certainly resonates. And so, Dennis, I wonder if you can talk about the early days. And I think there were 7, 8 people around the table. What can you share with us around those early days?
Okay, happy to. The roots for Coach, now Digital Health Canada, go back to 1969. In the 60s, there were no user groups of any kind anywhere. And if there was a user group, it was always vendor-based. So IBM had one of the bigger ones, an organization called ECHO, Electronic Computer Oriented Healthcare, or something like that. And they started meeting in 79. And they started attracting Canadians as well, because there was nowhere else for Canadian users to get together. So if they had an IBM computer, they were invited to go down to ECHO. Steve Husing was one of the early people to start going from Canada. In 73, Bob Zuckerman became the first healthcare industry coordinator for IBM. And Bob was obviously very involved in ECHO as well. So Bob and Steve started encouraging some of us to go to ECHO. And ECHO was always held in the wintertime in San Diego or in Miami or New Orleans, where it was nice and warm. So a number of Canadians went. At the sort of seedling meeting, 9 Canadians were there at that particular meeting. I'm not sure why I was there. I really don't, because I, at the time, was at St. Boniface Hospital, and we didn't have an IBM computer. Anyways, 9 of us were there. Steve pulled us together into a big round table in a dining room, wooden. No, there was no cloth on it. And he talked about whether we should start a Canadian ECHO. And there were 9 of us, and we all thought, yeah, well, that's definitely worth pursuing. In 75, we started having meetings, and 6 of us committed to meeting. Just for your interest, the 6 were Marie Barrett, who was the Director of Systems Management for the Ministry of Health in Ontario. Rick Hopkins was the Director of Finance for District 93 in Calgary. Steve Husing was the Assistant Executive Director of the Misericordia Hospital in Edmonton, so 2 Albertans. Rob Palmer was the Director of Project for the Assistant Center in the Department of Government Services in Regina. He had a broader mandate, not just health. I was there as Director of Information Services from St. Boniface, and Bob Zuckerman was there as the Healthcare Industry Coordinator for IBM. So the six of us started meeting, and even one of the meetings was even held in the dining room of my home in Winnipeg. I think that was the meeting where we went through all sorts of different names, a lot of laughs, going through various names of what we're going to call this organization, and ended up with Coach. And we ended up with corporate colors of red and white because Marie Barrett was wearing a red dress with white polka dots at that meeting. So that was how we created Coach. We went through and created our bylaws, created a corporation, and in 76, we had our first conference in Ottawa or Toronto, I think Ottawa. And there were 120 Canadians came. And we had made a decision that Coach wasn't going to be a Canadian version of Echo, that Coach was going to be vendor independent. And in fact, at the first conference, we didn't even invite any vendors. We wanted just users. That only lasted 1 year. 77, we did invite vendors. So we had our first meeting, and Steve was our first president. I was vice president, and I became president in 1978. And Steve, at that point, then moved to become executive director of Coach. And he also later became the president of ECHO in the United States, the first non-American to do so. We began our first group, and from then on, we held annual meetings across Canada. I can remember one meeting in Nova Scotia and Halifax while I was president that I got in late, quite late, at a very late meal in the hotel, and spent the whole night in 3 bathrooms I had in the presidential suite of the hotel, because I had food poisoning, which we determined was from the clam chowder. Anyways, we tried to hold our meetings across Canada, and you guys are now doing even better than we did.
I mean, it's such an impressive journey. And I think, like, Dennis, you and I were chatting a bit before the recording about how some of those early decisions, like to be vendor independent, have such ripple effects later on. And it's interesting to think about what the organization could have looked like had different decisions been made around that dinner table.
Yeah, well, like the first vote we had on the name and the fact it was going to be vendor independent, 5 of us were very much in favor of it. Steve was still wanting to be ECHO. But in the end, Steve agreed and voted in favor, so it was a unanimous decision by the board that we would be vendor independent. But to his credit, he stepped back from the IBM focus.
Yeah, and then that path obviously brings us to today with the association now called Digital Health Canada and its current president, you, Chris. And I'm curious if you can tell us a little bit about your interest in Digital Health Canada and how you started getting involved.
I mean, I've been fortunate to have worked for organizations that have been members for, since early days in my career, and many of them were involved in Digital Health Canada and Coach before that. So it was always sort of a core component of any kind of our professional development, like the early days in Courtyard, the consulting company. Through that, just got exposure to the resources, the network, the conferences, the connections, and the community. And honestly, those are the reasons why I still stay involved and have always wanted to be involved, because it is a core component of our industry. I think that's a nice thing about Digital Health Canada community. We all kind of know each other, like similar to I was talking about, like the family kind of feel that the HIMP program had. This was just a larger scale of that. So like going to eHealth every year, you really do know so many colleagues from across the country that network really is what drove me to continue to be involved. And then just being able to participate as a board member and give back to an organization that I had gotten so much from was really why I wanted to be part of the board and help out. So I've been a board member for a number of years now. This is my almost first year done as the president. And it's amazing to see with such a small team the amount of work that has been done. Very enlightening to hear the sort of the early days and how we got there, and even seeing some of the things. It's actually really nice, Dennis. Like some of the things that you guys talked about, we definitely see those as part of our core culture. And then now, obviously, with the foundation that's been laid by the team and bringing Sheila in over the last few months, I think there's some really exciting time for us as an association and for an industry.
Maybe we can push that forward. Like we've looked at the past, maybe we can look a little bit into the future. And this might be a question for Chris, you, and Sheila, actually, in terms of your hopes and your aspirations for the association.
Yeah, absolutely. So we've done a great job in terms of ensuring that we're continuing to provide value for our members across the four pillars that we focus on. But I think we're really just scratching the surface on a lot of that stuff. Like the neat thing about our association is that we represent members across all facets of digital health, which is a pretty unique and broad membership base. So how do you actually satisfy the interests of everybody in that space? I think we've got a lot of interesting and exciting things in the academic space. We've always done a good job in providing value to public and private sector at a larger scale. I think there's a whole mid-range, like startup, medium-sized company that I think we can do a lot more in, and we're starting to see expansion there, as well as attraction from those that may not have traditionally been in the healthcare space, but that are interested in applying their skills and expertise in the digital health sector. So who knows what it'll look like in another 50 years, but I think the future's bright and the organization is in a very strong place to be able to start building on a lot of what's happened and take us to that next step. But Sheila is the one that's now tasked with turning all those random comments into action. So yeah, happy for Sheila to provide her thoughts here.
It's interesting when I think, Denis, the two or three tenets that were the starting for Coach, and that really, Steve's message talking about the diversity of the community. We're not called data processors anymore, but it's that whole idea, right? You need to bring the administrators, IT folks, the clinicians, and that tenet has not changed. And the other thing that I remember, and I've been going to Coach conferences, I joined Kai High or my early 20s. I went to my first Coach conference, and yeah, it was like the community and the sense of purpose and the learning and the network. And I think that hasn't changed, I'd like to think. And, we don't have 120 people. We're at a zero plus to that. And we're not 7, 8 people anymore. We are almost 8,000. So we've come a long way, but I think those basic tenets hold true. And I think one of the things that we have an opportunity to look forward to at Digital Health Canada is even playing more of that leadership role and educating the public and influencing policy and creating awareness of digital health and all of the benefits to Canadians, to patients, to providers, and improving that patient journey. So I agree. It's the education, networking, learning opportunities, and that leadership and voice and influence, I think, are the 2 areas where we have so much potential. And the world is changing so quickly, and giving people the tools and providing them value to deal with and cope with that pace of change that we're seeing that's accelerating so much. And Denis, I'd be curious to sort of get your reaction to all that and what you are most proud of and where you think the future is going, or any advice to us as we carry on the torch, as it were.
I can't really give you any advice. The organization is so successful. The school is so successful. That time has passed for me. Since 2017, I have not stayed current at all. So I don't, I used to get dozen newsletters and journals and stuff. I don't get any of those anymore. So I'm not current. So I can only feel good because I've seen the progress that you're making. I got one little other anecdote which ties to leadership, which I always felt was the key. And Chris might remember that when it all came down, what was the most important thing in health informatics? And I always said it was leadership. When I was interviewed at the Royal Jubilee Hospital, after the first interview, I left with a number of conditions. One was to have a second interview to come back with my wife. Another one was that I would continue to go out of the hospital usually to Toronto or Ottawa, 2 to 3, maybe 4 times a year, at someone else's expense, not at the hospital's expense. Because I was quite involved. I was chairing a Stats Canada committee, and I was involved with a variety of Department of Health committees and so on. Anyways, the executive director said to me, "Why would you do that? Why would you ever leave Victoria?" And I had difficulty answering that question. Well, I said, well, it's part of my life. It's part of my profession. I have to stay involved professionally, and I have to do what I can to contribute. He said, I can't understand it. This man had no vision of the future. He just couldn't believe anyone would leave Victoria, let alone the island. Anyways, a little anecdote on the side. So just keep up the good work. I can't think of giving you any other advice, nor should I.
Chris, we've got the man, Denis Protti, has told us keep up the good work. So I'll take it. We'll give you a last word as well, Chris. So any sort of thing that you want to build on or any comments that you want to make?
I think you're just asking, reflections on like what the next years to come, and in the conversation is like, what are we surprised by or proud of or frustrated? Again, talking to my kids about this, and after they got over that someone actually wanted to talk to me on a podcast, it was asking them like, what is digital health? And I think the biggest realization is like they don't actually see digital as part of the equation anymore. Like that's like foundational, that's table stakes for them. So, the name coach, when we talk about computers and health, I feel like we're almost at that same place with digital health where we keep focusing on that part, where that's just part of everyday life right now. So I'm excited to see how this next generation actually pushes us to just move beyond digital health or these different health apps. Like that's part of their world that they live in. And I'm hoping that we can start thinking about it in that way as well, because sometimes I think we're our own worst enemies in terms of actually progressing. And like so much stuff is happening, and we have the opportunity to really make an impact. But we just probably got to look at it in a different way, and sometimes the kids help us to understand that a little bit. So hopefully, Dennis, and if we do this again, you still feel that we've continued to grow the organization at the same success and speed. So I just appreciate hearing the background and insights that you had as well.
And to close us out, if you had to pick one word to describe what digital health means to you personally, what would that word be?
Well, for me, the word would be support, because I've always felt that our entire reason for being was to support the healthcare process. All of the people providing healthcare, whether it's in acute care or community care or primary care or public health, to me, it was always a question of support.
Yeah, so for me, similar, it was empowerment. So I mean, really, what the field that we're in is, helping those that are providing direct care to patients, empower them to be able to do their job more efficiently, more effectively, getting them the information and the data that they need to make, decisions. So I think that's the neat part about the industry, is that even if you're a non-clinician, you can still contribute to that patient's care, but it really is making sure that everything we do is focused on empowering those that are part of that care team.
Thank you both so much for joining us for this episode. It's been such a fascinating look back at where we've come from, and an inspiring, I think, look to where we could go in the future.
Let me add my thanks. Denis, thank you for the UVic program. Thank you for Coach and Digital Health Canada. And thank you both very much for joining us here today. Kicking off season 2, 50th anniversary edition of Digital Health in Canada, our podcast. Thanks so much. Wow, that was a great conversation, a great discussion. I love that those two gentlemen were the first podcast of the season, and the whole theme about celebrate today, create tomorrow. We had such a nice trip down memory lane, and Denis was such a fountain of information of everything that he knows. And then, seeing the spectrum with Chris sort of being a product of the program at UVic, but also digital health a little bit too, right?
Yeah, that aspect of community and purpose really came through. Like even before we started recording, and you and Denis were talking about people you have in common and people you've seen recently. And I was just sitting here feeling so lucky to be part of this community and so lucky to be part of these conversations. It was interesting that came through both just in the pre-show chat. It came through when we were talking about UVic. It came through when we were talking about eHealth and Digital Health Canada. Like it really does seem to be part of the sector that we're in.
I agree. And one of the things, when you think about the eHealth conference, I mean, I've been going to the Coach and the eHealth conference, and it's our 25th anniversary for this one, as you know, but they've been going on for a long time. And, there was 9 people at the first one. There was always it's a small community. But even when we hit like 12 and 1,500 people that we're getting at the conferences now, there still really is that sense of community. And the digital health world in Canada, it's relatively small still. And people really do have that. There's no secret handshake, but there's a little bit of a love, because I think we all, very diverse backgrounds, and it has been forever thus, even based on that letter that Steve wrote. But that culture and that feeling of belonging is really important. And I think, and I hope that we will continue to maintain that for years to come.
It was also super interesting that for both of them, when we asked what digital health meant to them, it was really that supporting, that empowering. It hit, right? They said, it was like, yeah, I feel that. And I feel like that's certainly why I got into this field when I did my own hard right turn on my career path.
Well, and it's interesting that even, I was on the board of Digital Health Canada a number of years ago. And when we were doing the strategic planning exercise, one of the, what does the future look like? And our slogan, or whatever we called it at the time, was called bringing digital health mainstream, or something like that. So it gets to a little bit to the comment that Chris made, right? It's not digital health, it's not e-health, it's just health.
Although I don't know if you can drop the digital from your name. I think if you're just Health Canada, federal government might have something to say about that.
That name is taken.
I was thinking, though, we're actually remiss. We said there were 2 Digital Health Canada presidents on the call, but there were actually 3, because you have been a past president of Digital Health Canada.
I have indeed. Yeah, that's true. And in fact, at our conference this year, we are inviting all the past presidents to come back. And I think there were just around 30 or so of them. A lot of people are coming, and we've got great messages from those who are not able to make it. And I think that sort of speaks to the community as well.
As we kick off the year of celebrating Digital Health Canada's 50th anniversary, what else do we have planned? Like, how can people celebrate? How can people get involved?
Yeah, thank you for asking that question. I think the most important thing, if I could only say one thing about the 50th anniversary, is we want to engage our membership. And so you may have been seeing a number of happy anniversary videos that we've been publishing, and people are just, sending videos, and we've got some articles coming up and some ads in Canadian Healthcare Technology magazine. Where we'd be talking about the past and the future. You and I, we have our 50 people interviewed in 50, what are we calling it?
Trying to talk to 50 people on the podcast this year.
Yeah, and interviews, and just getting people to share their memories and what does digital health mean to you. And that's the most important thing. And, we really want to reach out also to media and celebrate and get the word out there beyond our community as well.
And this episode will air about a week before the eHealth conference. I know we will both be there. I will have my mic. So as part of our talking to 50 people over the course of the year, we will be trying to get interviews with folks on the floor, walking around. So if you do see us, please come say hi and share your own good wishes for Digital Health Canada.
Yes. And if you have any ideas for the 50th anniversary series or season, we'd be happy to hear those as well.
And with that, this has been such a great way to kick off the celebration. And we will see you next month with reflections from eHealth. Until then, happy anniversary to Digital Health Canada. We'll see you soon right here on Digital Health in Canada, the Digital Health Canada podcast. Thank you for listening to today's episode. Digital Health Canada members can continue the conversation online in the Community Hub. Visit digitalhealthcanada.com to learn more. Be sure to subscribe to the podcast to get new episodes as soon as they're available. And tell a friend if you like the show. We'll see you next month. Stay connected, get inspired, and be empowered.